The loss of appetite is one of the biggest hurdles standing in the way of recovery for cancer patients. Now, an innovative program being studied at NYU Langone's Perlmutter Cancer Center in New York City is looking to tackle this problem. Joining us now to discuss is WSJ reporter Lucette Lagnado and Dr. Omar Ishaq, radiation oncology chief co-resident at NYU Langone. Thank you so much to both of you for being with us. Omar, let me start with you. How extensively have malnourished cancer patients been studied before this?
So we know a lot about, we know a decent amount in the fact that they do worse overall. They have worse response to treatment. They don't survive as long, but there actually hasn't been much in the way of studying ways to improve their nutrition so that we can reverse that impact or mitigate it to begin with.
All right, so Lucette, how does this particular program work? Are meals customized to each patient's particular appetite issue?
Exactly. It's a fascinating approach in that dietitians who are specially trained in nutrition oncology are going to meet with every single patient in this study and go over their problems. So, for example, if their throat hurts because of radiation to the area, then they need to eat like soft foods. If they're deeply depressed, which, believe it or not, is a huge problem in causing malnourishment.
Oh, I believe it.
It's really interesting. Then they'll come up with sort of easy snacks for them to have. And then a very interesting nonprofit called God's Love We Deliver that got its start during the AIDS epidemic, delivering meals to AIDS patients, is joining with NYU and will be delivering the equivalent of 3 meals a day.
Wow. Dr. Ishaq, was this partnership your idea? Did you extend an invitation to God's Love We Deliver? And are they doing this for free, or how are they being compensated?
So they're doing this out of the goodness of their heart. They do this quite often, actually. They have been around New York for a while, and they provide foods to lots of patients. So I got in contact with them when I referred some of my patients to them. And then we came up with the idea together of perhaps we should study this. It's something that they're doing that's great, but if we could study to show that it works in a scientific manner, then hopefully we can take this from being a compassionate sort of program to an actual medical program.
Amazing. It's such a great cause. Now, let's talk a little bit about the specific dietary recommendations for each type of cancer patient. I mean, obviously, many cancer patients experience severe nausea and vomiting. So what are the dietary recommendations for this group, doctor?
So there are a lot of different symptoms that can prevent people from taking food in. And one, like you mentioned, is nausea and vomiting. Those are symptoms that we actually use medications to control. But other symptoms that impact whether or not somebody can take food in are mucositis. So if you have essentially a sunburn on the inside of your mouth or in your throat from treatment, or if you have a blockage somewhere in your throat or in your stomach, those are things that medicines can't necessarily fix, but changing the type of food that we give people can. So we can give them foods that don't have very much acid so they won't burn their throat, or foods that will pass by a blockage much easier than solid food.
Lucette, what about those patients that complain that now food tastes differently? It has a metallic taste to it.
Right.
What are the dietary recommendations?
Well, it's very interesting. I talked with the 2 dietitians in charge of this, who are part of the clinical trial, and they have wonderful ideas. So, for example, the lack of taste that so many cancer patients develop. So they suggest kind of flavoring foods using butter, olive oil, herbs and spices, any stuff that would liven it up. And for example, Dr. Ishaq spoke about using medicine to help with nausea. And of course, that's true. But they also talked about bland food, kind of oatmeal, just like stable.
Make it simple.
Yeah, make it simple. I love their kind of easy solutions, tailored for every different kind of patient.
That does seem very innovative. And Dr. Ishaq, how many patients are now enlisted, and when will you be able to tell if this is a success?
So we just started enrolling. So we've started offering the trial to patients, but haven't actually enrolled anybody yet. We expect, hopefully over the next couple of years, to enroll all 180 patients. And then it'll probably take us another year to really follow up and get the final results, because it's a pretty large study.
Dr. Ishaq and Lucette, thank you, both of you, for being here. It sounds great. Thanks for joining us.